You finish a heavy meal, sit back, and suddenly feel a sharp, rising heat in your chest. We usually brush this off as everyday heartburn, but inside your digestive tract, that sensation is the byproduct of an active, destructive breach. A highly corrosive liquid is burning through your internal defenses. This diagram shows exactly what that breach looks like. It is known as Peptic Ulcer Disease, or PUD. PUD is a literal physical cut, a total collapse of the thick mucosal wall designed to line and protect your gastrointestinal tract. When that barrier fails, acid eats directly into the exposed tissue, forming a jagged chasm called an ulcer. This structural collapse can happen in several distinct locations. If the acid burns a hole right in the lining of the main stomach cavity, it creates a gastric ulcer. If the damage drops down into the duodenum, the very first section of your small intestine, it becomes a duodenal ulcer. The damage can also move in the opposite direction. Chronic acid reflux, known as GERD, forces this corrosive fluid upward, severely burning the unprotected lower section of the esophagus. Locating these internal wounds doesn't require complex machinery. The body signals the site of the breach through a specific rhythmic pattern of pain that depends entirely on when you last ate. That post-meal stomach pain is more than an inconvenience. It is a signal of active structural damage, and the delay between your meal and the onset of the ache is the primary clue to its location. The primary symptom is epigastric pain, a sharp ache hitting the pit of the stomach. But the pain isn't random. The specific delay between your last bite and the onset of the burning identifies exactly where the tissue has failed. If burning pain kicks in within minutes of eating, food is hitting an open wound in the stomach, confirming a gastric ulcer. If sharp pain strikes 1 to 3 hours later, the food has traveled further down. This delayed reaction confirms a duodenal ulcer. These breaches rarely happen in isolation. The structural damage throws the entire gut environment into chaos. Patients experience severe hyperacidity, leading to heavy gas, crippling indigestion, and regurgitation where acid forcefully backs up into the throat. To stop the damage, we have to identify the causes. The destruction of the digestive wall is primarily driven by 2 factors. The first is Helicobacter pylori, or H. pylori, a bacterial infection shown here corkscrewing into the healthy tissue. The second is the chronic use of NSAIDs, common painkillers like ibuprofen that chemically erode the stomach lining over time. Ulcer pain follows a strictly predictable timeline. It is a chemical reaction driven either by invasive bacteria digging into the gut or by the steady chemical erosion from common over-the-counter painkillers. Pharmaceutical interventions are only one part of the solution. Healing an ulcer requires addressing the physical habits that compromise your internal plumbing. This mechanical schematic illustrates the lower esophageal sphincter, or LES. It is a tight muscle ring that acts as a pressure valve, sealing the top of the stomach. Certain foods, specifically caffeine, chocolate, and mint, contain chemical triggers that mechanically relax this valve. When the tension drops, the door swings open, allowing stomach acid to flood upward into the esophagus. Heavy, high-fat meals present a different mechanical failure. Fat drastically slows down gastric emptying, the rate at which food leaves the stomach. This turns the stomach into a stagnant, overfilled tank of acid that cannot drain, placing immense upward pressure on the LES valve. Once the tissue is compromised, direct physical irritants make the situation worse. Extremely spicy foods, acidic citrus juices like orange juice, and concentrated tomato products act as corrosive agents, pouring literal salt in the wound of a damaged esophageal lining. Even your clothing alters your internal physics. Tight jeans or restrictive belts increase intra-abdominal pressure, the physical squeezing force inside your belly. When you compress the stomach from the outside, the acid has nowhere to go but violently up. Gravity is a crucial digestive tool. Eating 2 to 3 hours before bed removes gravity from the equation. When you lie down flat on a full stomach, acid easily travels horizontally into the esophagus. Elevating the head of the bed utilizes gravity to keep the corrosive fluid contained at the bottom of the tank. Late-night snacking, tight clothes, and heavy fats break the fluid dynamics of the gut. They force open the pressure valves required to keep digestive acid safely isolated. Beyond food and physics, there is a hidden variable in the bloodstream. Many daily medications unknowingly act as internal saboteurs. They chemically manipulate the gut by dropping LES valve pressure, stalling stomach emptying, or directly stripping the protective lining. The list of chemical offenders is extensive. Nicotine and everyday NSAID painkillers are primary culprits, but the list also includes nitrates, calcium channel blockers used for blood pressure, tricyclic antidepressants, and even certain antibiotics like tetracycline. Lowering overall systemic pressure is mandatory for the gut to heal. This requires active weight management to reduce visceral fat pressing against the stomach, and the cessation of nicotine and tobacco products to restore proper muscle tension in the digestive valves. Managing the disease requires addressing 3 variables at once. You must use the timing of the pain to understand the damage, adjust your physical environment with gravity and loose clothing, and remove the specific chemical triggers, like chocolate or NSAIDs, that compromise the stomach's valves. Healing from peptic ulcer disease requires a strategic approach. By observing your symptoms and managing the mechanical forces of your diet and habits, you can stop the internal fire and rebuild your digestive defenses.